The state government is seeking legal advice about how to ensure that people comply with mandatory reporting of rapid COVID tests. But some in Sydney's multicultural community fear they're being left behind, with rapid tests difficult to find and messaging only in English.
Missy Hanikaseta is a bilingual community broadcaster.
Communication is power.
She fears the government's leaving non-English speakers behind.
It's very confusing, especially for our mature age community, irrespective of where you come from. You're confused with how to get yourself onto the sites on a little telephone.
COVID-positive people will soon have to register their rapid antigen test results with the government, but the tests remain pricey and hard to find.
We're probably the only developed country in the world that hasn't provided free rapid antigen tests to the community, or at least have price caps.
The government says it's aware the English-only instructions is also a barrier.
Government departments and agencies will be working out the logistics of that shortly.
But the escalating COVID crisis is waiting for no one. 11 more people have died, 6 women and 5 men aged over 70. 9 were fully vaccinated, 2 were unvaccinated. There are 2,186 people in hospital with COVID, with 170 people in intensive care.
Even though the case numbers in intensive care are lower than when we had Delta, it's proving to be more challenging and more difficult. And the main reason is the furloughing of staff.
The strain is stretching across the health system, with New South Wales Ambulance issuing an apology after an ambulance couldn't be found to aid an unresponsive newborn.
We have an ambulance system in New South Wales at complete and utter breaking point, and unfortunately this tragic set of circumstances we're likely to see more of unless this government invests quickly in providing additional paramedics.
Perhaps a sign of its desperation, the government is calling out for more nurses, offering to pay New South Wales residents to get a diploma, and a job as an enrolled nurse is guaranteed at the end of the course. Rani, Hayman, ABC News, Sydney.